Hi, I'm Dr. Paul Dalley. I'm here today to talk about radiofrequency ablation of varicose veins, specifically the long saphenous vein of the leg. Available over the last 5 to 6 years has been a treatment called radiofrequency ablation treatments. What it does involves placing a catheter inside the vein, which has a little tip on it that heats up very hot 120 degrees centigrade and actually burns inside of the vein to cause it to seal off. I like to sometimes think about this like welding the vein closed. This procedure is done with placement of an IV in the varicose vein, usually around the knee level, and then use an ultrasound to thread the catheter up and position it up where the vein starts having its problem or insufficiency. We then place numbing medicine and fluid around the vein itself to collapse it onto the catheter, also makes it so you won't feel anything. And over a 5 to 10 minute period of time, we burn the vein as we withdraw the catheter. We then pull the catheter out, pull the IV catheter out, put a Band-Aid on it, and the procedure is fairly complete at that time. We can then, at that moment, also ultrasound the vein, make sure that it is closed off, make sure there's no blood flow in it. We can check the deep veins, make sure there were no complications. Once that portion of the procedure is done, we can then dress your leg with pressure stockings and gauze. Or if you have secondary varicose veins or insufficient perforators in the calf or in other locations, we can do a procedure called microphlebectomy or phlebectomy. In this procedure, we put a little local anesthetic around the varicose vein site that we're worried about. We then make a small incision, usually between 1/8 and 1/4 inch in size, and reach in with a little small hook, pull the vein up, and either break the vein or tie it off with a small suture. We then allow it to retract back under the skin. And once that is done, then we put a little tape over that incision, and again, usually sutures are not required. Once this is completed, we then wrap your leg, and you can walk out of the office. All of our patients are back to normal activity within 3 to 4 days. These are some of the treatments available for treatment of venous insufficiency, varicose veins, and pains in your legs. Every patient's treatment needs to be tailored to their specific needs. If you're interested in pursuing this further, please contact us or your physician for further information.